In today's video, I'm going to be going over how to read a remittance advice. Now, in last week's video, I spoke about how to fill out a CMS 1500 form. So if you haven't seen that, I'm going to link that above. I went through every single box on the CMS 1500 forms. So make sure you check that video out after you check this video out. But today's video, we're going to be going through the remittance advice. So if you've done everything well and you have sent out a claim, you are hoping to get back a remittance advice that will tell you what the payer has paid or what the payer has denied from the claim. I'm going to go through about 5 different payers' remittance advice. Remember that the payers' format of their remittance advice looks different. So this is just an example of what a remittance advice would look like and what you should look for, the key points that you should look for so that you can know what happened and how you need to apply it to the patient's account. So remember to check out my shop where you can get this shirt. It says medical billing is more than submitting claims. And of course, you know that because if it was just submitting claims, then we probably would not have a job. So just make sure you check out my website for more medical billing merchandise, and we'll jump into how to read a remittance advice. So first, we're going to start off with Cigna's remittance advice. These remittance advice that I'll be showing you today are paper remittance advice. However, you can receive remittance advice electronically through your practice management system, or you can receive it online through your clearinghouse. So the remittance advice will look different through different houses, different practice management systems, and through different payers' paper remits. Again, this is just an example. So I'm going to zoom in so you can see clearer. I hope you can. And we're going to start off on the right-hand side where you will see where the remit is coming from. This one is coming from Cigna. Normally, you will see the payer to the top of the remit. It can be in different positions, but for the most part, you usually find out the payer's information to the top of the remit. Then you will notice that you see the provider number, the provider's name. The provider can be the actual physical provider, or it can be a practice. So basically, it is who is the billing provider. You have the date through which the claims were processed. This is an important date to know because you may have sent out one claim several times. If you had sent out one on 12/1 and one on 12/10, then you would know that this remit belongs to the claims you sent out on 12/1. It could not possibly belong to the ones that you sent out on 12/10 because it's the one for 12/10 was not sent out when this remit was processed. I hope that made sense. Then we're going to go down to these tabs that are highlighted, or these boxes that are highlighted. You have the procedure date, the procedure code, adjusted procedure code, billed amount, adjusted procedure code amount, allowed amount, not covered discount, deductible copay amount, coinsurance amount, and some other ones here. I didn't highlight them all because not all of them apply to me, but if they apply to you, then these are the ones that you need to look for. The ones that I highlighted are normally the general ones that are applied to most billers and what they are looking for. On Cigna's remit, you will notice that directly under these boxes, you don't see the information for that. You see other things. So here is a reminder. You can read that. I would always recommend that if you are new to billing, to make sure that you read everything on the remit so you can know what they are saying to you, what you need to do. If you are a biller who is established, of course, you may already know what to look for, so you don't really need to read everything because it might be repetitive. Then we go down to the information, basically like the demographics, who it's for, stuff like that. So you see the patient name, the patient ID number, This ID number is normally the ID number from the practice management system that you put in to identify the patient. You have the patient's responsibility to the subscriber. The patient and the subscriber does not have to be the same person. It can be the same person, but it may not be the same person. In this example, the subscriber and the patient are two different people. That's why it says dependent. You see the provider network status, which is in network. Not all payers put this same information on their remittance advice. Some payers may, some payers may not. And also the terms that they use may be different. So keep that in mind as well. Then you have the subscriber's name and the subscriber number. The subscriber's name is the person who the insurance is under. So for example, if you have insurance under your spouse, then you might be the patient. Let's say your name is Jane Doe, and the subscriber might be your husband, his name being John Doe. So those two names will be on the remit. And then the subscriber number is usually the main number. So if the subscriber's number is 1234567, then the dependent or the dependents may have the same set of first numbers and maybe a 01, a 02, or some other numbers to distinguish each member on the account. Then we have the receive date and the process date, which I already explained why it is important. You have the reference number, and in this case, the reference number for Cigna's remit is the claim number. So if for any reason you need to ask questions about a claim, this is the claim number. If you need to send a corrected claim and you need to put the claim number on the new claim, then you would use this reference number. Like I said, sometimes the terms that the payers use will vary. Then you have the check number. And on Cigna's paper remits, I like the fact that they put all of this information here. Most payers that I've dealt with do not put this information on the remits, but Cigna puts the out-of-network information that has been met or not met, the in-network, deductible, family out-of-pocket, individual out-of-pocket. They put a lot of information in this little area. So it helps you determine why certain things are processed the way they are. Now let's go back up to the pieces that was highlighted. So if you notice procedure date, the procedure up here is referencing this information down here. It referenced the date of service, which is 10/20/2020. Then you have the procedure code, which is 58150. If you had an adjusted procedure code, it would go here. Sometimes the payers may change what code you have. It doesn't always happen, but I have seen it happen for E&M visits. If you have billed a patient as a new patient and they're supposed to be established, I have seen payers adjust the code that you sent to an established code. Then you have the billed amount, you have the allowed amount, and the difference between the billed amount and the allowed amount is you can bill whatever you want. You may notice that providers bill an astronomical amount sometimes just to make sure that they are not going below what the payer is willing to pay. So the billed amount is $4,200, but the allowed amount is only $661.67. Then the not covered discount. So that is the difference between the billed amount and the allowed amount. If you notice, the plan paid the full amount of $661.67. Then below you will see it says balance, and that is where it would say if the patient had anything that they was responsible for. In this case, the patient was responsible for nothing, and the payment of $661.67 was paid to the provider, which is the rendering provider. There's a difference between the rendering provider and the billing provider. If you do not know what that difference is, I will link a video above that I did on all the numbers and what they mean on the claim forms. In this particular claim, we have two different claims. So if you notice up top, it said 1 here, and then it says 2 here. So this is two different claims. I like when payers put multiple patients on one remit. I don't like to be going back and forth and having to just, it has 50 remits and it has 50 patients. If it's all from one payer, just put it all on one remit. That's my thing, but let me know how you feel about that. And again, we will go through the same thing. The patient's name, patient's number, if they're a subscriber, the date of service, all of those information is what's important for you. These are the information that you want to know. Now we're going to move on to another remit. And this remit is for the Medicaid program in the Virgin Islands. If you notice or compare it to Cigna's remit, it looks completely different. It is way simpler. It does not have all the bells and whistles, but it has the pertinent information for you to know which claim to apply it to. Over here again, instead of on the right-hand side, on the left-hand side, you have the payer. Then you have the billing provider and the payment ID. You go down a little further and you have the claim number, the member name, the date from, date to, claim amount, paid amount, claim copay, and status. Now, if you notice, it is missing things like the allowed amount. It may miss things like the not covered amount. Again, each remit looks differently and have on different information. However, it does have the pertinent information that you need, which is the date of service, the member that it's for, how much was billed, how much they paid, and basically that's what you need to know. In this situation, if something was denied, it would say denied in the status area, and I would have to go into the payer's portal to see why it was denied, to see the reason for why it was denied. A lot of payers put the reason on the same remit. This payer doesn't. It is empty. So I need to go into the payer's portal and see why it was denied. I would also need to see in the payer's portal maybe why there was a difference in how much was billed and how much was paid. In doing this so long, I already know certain fees and the reasons why, so I don't necessarily have to do that all the time. But if you are a beginner biller, you would need to do that. Go into each and every claim and figure out why there's a difference. If what they're paying you is correct, you need to do your research. Now, remit number 3 is for Aetna. And Aetna is a well-known payer. You have that information up top here to let you know that it's Aetna. Then you go over to the right, you see the TIN, the NPI, and the TIN is your tax ID number. It's also called an EIN number. You have your NPI for the billing provider. You have the check number, the claim amount issued to the member, if there was, because sometimes the payer sends the payment to the patient. You have the claim amount issued to the provider, the check issue date, and the clean claim date. Going back to your left-hand side, you have the claim status information, and Aetna provides a call reference number. Not all payers do that. I never even really use that per se, but you normally use the claim ID number, which you will see is further down here under the patient's name, the relationship, and then you see the claim ID number. You see the receive date and you see the process date and the status, the patient ID and the member number. So if you start to notice, you're starting to see the same things over and over. You're starting to see the patient name. You're starting to see claim ID number. You see the patient ID. You see the member number. You see the date processed and the receive date. Most payers have that information on their remit advice. Then you go over to the right, you see medical product, dental product, medical group number, dental group number. Again, some of this information may not apply to you for every single claim, but there may be a situation where it does apply. So let's say, for an example, you have a patient, they had 2 different Aetna accounts. One was an Aetna account for this specific medical group, and they changed or they had a new employer, and now they went to another account for another medical group. So knowing the medical number, you might say, well, Aetna, you processed this claim under the wrong group number. Again, this does not always apply, but it may apply. So you need to just look around, know what you can see, and figure out what's going on. To me, billing is a lot of investigation work. Sometimes it may seem simple and, it's just boom, 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 look at this, look at that. But sometimes you have to dig deeper to try and figure out why things are not processing correctly. In this situation, Aetna has the same kind of tabs, not with the same wording, but the same types of boxes up top. In this situation, though, they don't have anything in between. They have the information that they are applying to in that specific box directly underneath the box. So you see service dates, and it has 10/15/2021 to 10/15/2021. The place of service, which is 22, which is outpatient. Now, I may do a video about place of service, so let me know if you want me to do something like that. But you normally see where the place of service is because that determines certain things. You see the service code, which is the 47562, and that is with a modifier 80. I'll also do a video on modifiers. I got that request, if I'm not mistaken. But modifiers are something that you would use to help with telling the story about that specific code to the payer. So I can do a video on that, which is probably coming down the pipeline because I did get a request for that. You see the number of services, the submitted charges. Again, submitted charges, that's a different term. When we were looking at Cigna's remit, it said billed amount, if I'm not mistaken. Then you have the allowable negotiated amount, which is the allowed amount. You have copay, not payable. And then the not payable is the difference between the submitted charges and the allowable. You have C remarks below, which we'll do a video on remark codes. You'll see it says, check out the remark codes. It has a 1 and you have the 1 below here. The deductible, the coinsurance, the patient responsibility, the payable amount. Below here, I really like how they laid this out because it says total patient responsibility. This can help you determine what you are supposed to be charging the patient. Now, I recommended in a video that I did before, or I kind of always recommend that you make sure the patient pay up front. Sometimes that is accurate, sometimes it's not. But in this situation, let's say you did not have the patient pay up front, then you would know for sure that the patient is responsible for the $112. It says it up here where it says patient responsibility, and it says it here where it says total patient responsibility. So if for some reason you get a question from the patient, you know that is the correct amount. Then you have the claim amount issued to the provider. That's how much they paid you. That's how much the check or the EFT is for. Our fourth remit is from the famous, infamous Medicare. And for Medicare, we have the information to the top. It tells you that it is Medicare. Oops, I went too far. They tell you that it's Medicare. And then they have here the provider or the practice name. Again, the provider practice name is the billing provider. So it could be the practice or it can be an actual provider. You have the NPI, which is the billing NPI, the number of pages or the page number, the date, and the check or EFT number. Then you have the sections like how you had on Aetna and on Cigna Remits. You had little sections that tell you what the numbers are for. So again, the numbers may not be directly under this information. If you notice, you have service date, but the service date is not on this line. The service date is on this line. So just keep that in mind. But you have service date, place of service, procedure, modifiers, billed, allowed, deductible, coinsurance, and so on. You go down a little further and you see name. So this is the name of the patient, and then you see MID. That is the Medicare ID number. It's normally 11-digit character, just so you know, especially those of you who deal with Medicare. You have the account number, which is the number that you get from your practice management system. And then you have the ICN number. And the ICN number for Medicare is the internal control number, and it is 13 digits. If you notice, for Cigna, I think Cigna's was a reference number, and for Aetna, Aetna was the claim number, and for Medicaid was claim number. Again, the terms that they use will be different, so you need to know which terms they're using for each payer. Then you have accept assignment, yes, and you have MOA, which are the remark codes that are used to convey the appeals and other information specific to the claim. These are not financial adjustments. So if you notice all the claims, you see a MOA and you see some letters and numbers. Further down, you see, or you would see, the rendering NPI, which is the preferred provider. You see the service date, which is 12/29 to 12/29/2022. The place of service 11. The procedure 99214. There's no modifier. The billed amount $300. Allowed amount $130.19. No deductible. The coinsurance is $26.04. And then if you notice here, you see some more codes. This is contractual obligation, and you will see what that means when we go further down. The 169.81 is the difference between the 300 and the 130.19, and then there is $102.07 that was paid. Now on this particular remit, there were only one line per patient's claim. If there was more than one line, you would notice that it says more than one line. It would have another line with the same information. So when you go further down, you notice the patient responsibility, which is the 2604, which we got from here, the coinsurance, and then the claim total. So if there were lines, it might have been a line for $100 billed. So instead of it saying $300, it would say claim total $400 because now there would be a second line with $100. So the 300 plus the 100 is 400. And you go further down and down, the allowed amount, the deductible, and if all of that information would be added up. Now for Medicare, Medicare would usually cross over claims. If they know that a patient has a secondary insurance and they have that on file, they would cross it over to that secondary insurance. Medicare does not always do this. Let me just state that. They do not always do it. And even sometimes they say they have done it, as in this situation, it says claim information forwarded to USVI Department of Human Services. You may check the USVI Department of Human Services and they never receive the claim. So you need to do your due diligence and make sure that they have received, or the secondary has received, the claims. As we go further down, so on this remit, there are 1, 2, 3, 4, 5 claims on this remit. If you notice, you will see the number of claims are 5. This is all the totals of all the claims that are on this remit. One thing I want to also mention is that you need to make sure that the remits add up. So if there are 5 claims on this remit, the amounts that are paid, you need to make sure that that is the correct total amount, and that's the amount that you received on the check or the EFT, the amount that's deposited into your account. You need to do your checks and balances to make sure that everything adds up. And then you have the codes. So the same codes we were speaking about earlier with the MOA and the contractual obligations, these tell you what those mean. Sometimes it can be confusing. You might read it and still don't know what it means. But for the most part, they help you determine what you need to do next and why the claims were processed the way they were. And our last remit is going to be from United Healthcare. This particular United Healthcare is the United Healthcare Medicare Advantage Plan. So you see up top it says United Healthcare Medicare Solutions. And then it will show you again the practice or provider name. Knowing the practice or provider's name, especially if you maybe have several practices or you have several providers, you know who these claims apply to. If you see a name that's wrong, if you see a practice information that's wrong, you need to address that with the payer. We have the check number, the reference number, the check date, the reference number, the check number, the amount, the tax ID, and the payer ID. As we come down a little further, you see the provider number and the name, the UPIN number, which for a long time we haven't used UPIN numbers. So when I saw this, I was a little shocked. But the UPIN number in this case is the first 6 of the NPI number. I don't know if it's always like that, but in this case, that is what it was. Then you have the member. So you have the member's name and the member's number and the member's account number. Again, the account number is from the practice management system. You have the claim number, just in case you need to reference that, you know what it is. And on this remit, you notice it also shows you the diagnosis that was used for this particular claim. In the other 4 remits that we had, you did not see any diagnosis. You see the rendering provider's ID. And in this case, for each claim, you also need to put the PCP's name. So here's the PCP and the PCP number, meaning their NPI number. Then we have the tabs that we usually have, or the terms that we usually have, which is the date of service, the procedure, the claim amount, the member's responsibility, deductible, the ineligible member amount, the ineligible provider amount, the code, discount, the sequestration, which the sequestration is the mandatory payment reductions in the Medicare fee-for-service program. If you deal anything with Medicare, you will notice that we've been having that for the past couple years now. I think it began at 1%, now it's at 2%. So I think it actually has to go up, but you need to check that out yourself about that. But they deduct a certain amount from each claim. And then you have the amount that was paid. In this case, we have two claims, and they just happen to be the same member. If the member was different, then you would have seen another section that said member number, account number for this claim, so that you can see who it applies to and where to post it in the account. And then we have the last page, which shows you the codes about how they process the claim. I hope this video was helpful for you, give you an example of what a remit advice may look like, and just to know what are the key information that you need to look for when you receive one and you need to post it on the patient's account. I will see you again in my next video.